Welcome to This Explainer. Today, we're diving deep into the true, visceral, everyday reality of life on the high seas between 1690 and 1730. We're going to completely strip away those romanticized Hollywood myths of the Golden Age of Piracy. Instead of focusing on legendary treasure or massive political empires, we're going to look at the human experience of these outlaws. We'll explore the damp, rotting wood of the ship's hull, the truly horrifying conditions of shipboard surgery, and, surprisingly, a revolutionary social safety net born out of sheer survival. Let's get right into it.
So, think about this for a second. What truly killed the most pirates during the Golden Age of Piracy? Pop culture would absolutely have you believe it was a flying cannonball, a swinging cutlass, or maybe the hangman's noose. But as we dig into the historical and archaeological records, a completely different reality emerges. The greatest threat to a pirate wasn't the Royal Navy at all. It was an invisible, microscopic reality thriving right there in their isolated, incredibly hazardous floating communities.
2 million. Let that number sink in. That is actually the conservative estimate of mariners killed by scurvy between Christopher Columbus's first voyage to the New World and the mid-19th century. This single, devastating disease was responsible for more maritime deaths than combat, storms, shipwrecks, and literally all other diseases combined. It was the silent, ultimate apex predator of the oceans, and it absolutely dictated the daily existence of every single person who dared to step onto a ship.
And the sheer physical horror of scurvy is incredibly difficult to overstate. You see, the human body just cannot synthesize vitamin C. So when long voyages forced crews to rely strictly on diets of salted meats and hardtack, their connective tissue simply began to fail. I want you to imagine the sensory nightmare here. We're talking extreme lethargy, terribly swollen joints, teeth literally loosening and bleeding gums, and most terrifyingly, old bone fractures suddenly separating and reopening inside the body. If left untreated, it all eventually led to sudden cardiac arrest.
Now here's where it gets fascinating. The operational choices of these outlaws actually became their greatest medical defense. Take legitimate navies, like the British Royal Navy. They executed continuous, rigid, months-long ocean transits, which inevitably led to devastating, massive losses from scurvy. But pirates? Operating outside sovereign law gave them immense operational flexibility. They made frequent landfalls to clean or careen their ship hulls, and while they were ashore, they'd gather fresh citrus, wild greens, maybe even sea turtles. Even plundering merchant ships yielded fresh onions and preserved fruits. Without even fully understanding the science, this acted as a highly effective accidental therapy that essentially kept their crews alive.
But scurvy was far from the only threat out there. The daily environment was just unbelievably hazardous. Try to picture the smell of those cramped, damp, dark lower decks, completely overrun by rats and lice. When their freshwater casks inevitably became fouled with bacteria, the crew would actually mix the contaminated, slimy water with beer, wine, or vinegar, just to mask the horrendous taste and smell. Of course, that did absolutely nothing to kill the pathogens. The result? Rapid, deadly outbreaks of amoebic dysentery, which they historically called the bloody flux. Oh, and any landfall in the tropics meant mosquitoes carrying malaria and yellow fever were brought right back into those suffocating quarters.
So how did they possibly fight all these ailments? Well, to understand that, we have to look closely at the material culture they left behind. Marine archaeologists have actually recovered a massive inventory of medical artifacts right from the wreck of the Queen Anne's Revenge. Yes, the flagship of the infamous Blackbeard. These weren't just chaotic bands of thugs, as it turns out. They ran highly structured, surprisingly sophisticated shipboard clinics. We're seeing things like precision nesting weights for compounding medications, brass set screws for surgical tourniquets, and pewter bleeding bowls.
These artifacts tell a pretty grim story of everyday life, though. Syphilis, as you might guess, was rampant among sailors visiting port brothels, and the standard medical treatment of the era? Well, it involved using heavy metal urethral syringes to inject highly toxic mercury directly into the infected individual. It's a truly excruciating procedure that perfectly highlights the desperate constraints of early 18th century medicine. In fact, in a lot of cases, the systematic heavy metal poisoning caused by that mercury was just as lethal as the venereal disease itself.
Because of these relentless daily medical threats, a trained surgeon was quite literally the most valuable plunder a pirate crew could ever capture. There's this great quote from Captain Charles Johnson in 1724 noting how pirates forced carpenters, caulkers, armorers, surgeons, and musicians on board. They didn't just steal gold or sugar, they actively stole specialized labor. They would regularly kidnap carpenters and surgeons from the merchant or naval vessels they captured, pressing them right into service. The survival of their entire outlaw community completely depended on that medical expertise.
But the really crucial point here is how this dynamic played out legally. While surgeons were absolutely forced aboard, they were typically not forced to sign the pirate articles, which was the sworn code of conduct for the crew. And this created a brilliant, highly intentional legal loophole. If the pirate ship was eventually captured by authorities, the surgeon's lack of a signature served as undeniable proof that he was a captive, not a willing pirate. It was a fiercely pragmatic arrangement. It saved the doctor from the hangman's noose while giving the pirates the life-saving medical care they so desperately needed.
Now, the surgeons certainly didn't work alone. They relied heavily on a non-professional assistant known historically as the loblolly boy, a name derived from the thick, frankly unappetizing porridge they fed to sick sailors. The reality of this specific job was incredibly gruesome and highly dangerous. The loblolly boy handled the most unglamorous labor you can possibly imagine. We're talking inventorying herbs, emptying infectious bedpans, physically restraining screaming patients during unanesthetized surgery, and yes, disposing of amputated limbs directly into the sea. I really want you to picture the intense climax of a naval battle for a moment. The surgeon's operating theater wasn't some pristine, sterile room. It was the cockpit, a space set up deep down in the dark belly of the ship, below the waterline just to protect the medical team from flying cannonballs. It was a hot, claustrophobic, terrifying space. Just before an engagement, the loblolly boy would literally strew coarse sand all across the wooden floorboards. And that wasn't for hygiene. It was strictly to provide traction, to prevent the surgeon from slipping in the massive amounts of blood that would inevitably pool around their feet.
And the absolute greatest fear inside that cockpit was fasciolus, fully mortified or gangrenous tissue. See, when heavy iron cannonballs smashed through a ship's wooden hull, they created massive, jagged wooden splinters that would just tear through human flesh and violently shatter bone. Because there was absolutely no concept of antisepsis or antibiotics back then, these complex, dirty puncture wounds rapidly turned gangrenous. To save the patient's life, that infected limb simply had to go. So amputation wasn't just some dramatic pirate trope used for effect. It was a desperate, immediate life-or-death defense against horrific infection. We can actually systematically reconstruct this incredibly brutal procedure from the historical evidence. First, they'd apply a heavy brass screw tourniquet. Second, the patient was given a leather strap or maybe a piece of wood to bite down on. And here's the kicker. They were completely awake. Contrary to popular myth, experienced surgeons deliberately withheld rum or opiates before surgery. They were terrified it would dangerously weaken the patient's pulse and cause fatal cardiac collapse right on the table. Third, the surgeon raced against the onset of physical shock, expertly slicing flesh and sawing through bone in under 2 minutes. Finally, they'd viciously cauterize the bleeding stump with a red-hot iron.
But you have to wonder, what happened if a pirate crew hadn't managed to actually kidnap a doctor? Well, when survival was on the line, sheer institutional constraints forced a ship's carpenter to step in. Carpenters were skilled shipwrights, highly accustomed to plugging cannonball holes and working under immense pressure. More importantly, their heavy handsaws, adzes, and drills very closely mirrored surgical instruments. When a limb absolutely had to come off to stop gangrene from spreading, the ship's carpenter instantly became the emergency trauma doctor.
Just listen to this truly chilling eyewitness account regarding the carpenter on pirate captain John Phillips's ship. The witness states the carpenter separated the limb from the body in as little time as he could have cut a deal board in two, after heating his axe red hot in the fire and cauterized the wound. I mean, it is just a staggering testament to the extreme physical hardship, the crude resilience, and the unbelievable pain tolerance required simply to survive in this era. The carpenter didn't carefully use a delicate surgical saw, he literally hacked it off like a piece of timber and sealed it shut with a galley axe.
Yet it was exactly this constant, terrifying threat of horrific mutilation that drove these outlaws to create something incredibly profound. Pirates operated under what they called the Articles of Agreement. These were democratic codes solemnly sworn upon a Bible, or, quite fittingly, sometimes a hatchet. Under these articles, every single man had an equal vote, but it went way beyond just dividing up plundered treasure. These codes established a revolutionary social safety net. They deeply understood the extreme risks of their labor, and they intentionally built a structural institution to protect each other.
What they established was, effectively, the world's first modern disability insurance program, predating legitimate national systems by centuries. The articles specified exact guaranteed payouts for workplace injuries. A lost right arm netted 600 pieces of 8. An eye or a finger brought 100. They formally codified the economic value of a pirate's body. They made absolutely sure that a man crippled in service to the crew would never just be tossed aside or left to starve in some random port city.
And crucially, you have to understand, this was not charity.
It was a deeply systemic safety net. Those disability payouts were taken directly out of the public stock of plunder before any individual crew member ever received their personal share. Furthermore, a maimed pirate was guaranteed lighter, lifetime employment aboard the ship if they chose to stay. They firmly institutionalized care for their most vulnerable members, completely rejecting the harsh, disposable treatment of sailors that was entirely standard in the merchant and royal navies at the time.
So all of this leaves us with a final, truly profound question to consider. How did outlaws, men entirely cast away and violently hunted by civilized society, manage to pioneer a more equitable, democratic, and protective healthcare system than the legitimate empires that were hunting them? It really forces us to look past all those cinematic myths of pure chaos and violence and finally recognize the profound humanity, the structural genius, and the sheer unyielding will to survive that defined the everyday reality of the Golden Age of Piracy. Thank you so much for joining me on this explainer, and keep questioning history.